But once we start to get in our 50s and 60s and above, for women, estrogen starts to drop, and then their bones start to get a little more weak and brittle.
You need that at this age range to maintain that social circle because we're social animals.
Doc, you just want to throw pills for everything. You guys, you doctor people, you just want to put pills on everything.
If you're a man with low testosterone, you're a woman who has gone through menopause, you got to get your bone density tested.
If it's common and we can catch it early, we can do something about it. Do you remember when we were rounding at one of the places and like everybody all of a sudden just got chlamydia and gonorrhea? All right, everybody. Welcome back to another episode of What the Health
podcast presented by Epic Health. I'm Dr. Greg Naiman.
And I'm Dr. Ted Naiman.
All right. We're going to be talking today and calling out a bunch of myths around the 60s.
Right. So the 60s doesn't have to mean that you're slowing down, and it doesn't mean that you're already purchasing or looking for that rocking chair.
People even get rocking chairs anymore?
I don't know where the whole, yeah, I mean, maybe. I don't mind rocking chairs. I like rocking chairs. Cool. I mean, I guess maybe it is a cool thing. Maybe you need to have more rocking chairs.
Yeah, it's, well, anyway.
All right, let's get back to the health stuff.
So, yeah.
So let's talk about what are some of the things we want to talk about today with the topic.
Bunch of good topics today, I think. Mostly because I wrote them. So, cognitive health and staying mentally sharp. Right? That's a big thing that we see or get a lot of questions about. So
why is it? Why is it people who are like, maybe above their 50s and 60s have some issues with cognitive health? Or what is the concern? What can they do, like maybe to slow it down?
So cognitive health, again, when we start talking about it from a medical perspective, this is when I put on the bow tie and the tweed jacket and I start talking about cognitive health. So we got to remember that our brain and our nervous system, all our neurons and all of those cells inside of our body in the area of the nervous system, it's responsible for just a kind of a handful of things, right? It's what holds our attention. And again, so that we were paying attention to stuff, and that because we pay attention, we can then learn things. And then we call that part of higher executive functioning.
Dude, you're going to start boring the shit out of everybody was talking like about that stuff.
I'm just saying. So this is, again, I would probably lost their attention already. Right. You're testing their attention by cutting me off.
Right.
But it's all good. So again, and then of course, the motor skills, meaning the things that you do, movements, and then of course your sensory skills. So like if, they keep interrupting me and I kick you, you're going to feel it, right? So those are the activities of the, when we start talking about your whole motor neuron.
So is it a cog?
Sensory.
Why do they call it cognitive?
Yeah, I don't know.
Where does it even come from?
So then what happens in that age range, right? Again, when we're talking about in our 60s and you're starting to see that people's attention starts to lapse or their ability to learn new things, right? I remember when you tried to learn violin for a minute.
Right.
For about a minute.
Didn't go well.
And yeah, not that you're saying you're 60 because you're younger than me. So,
right.
But again, so now, what happens and why are those things happening at this age range, and what can we do to help them to stay sharp, right? Stay mentally sharp, their attention, their ability to learn things. What are some tips and tricks?
Yeah, so going back to like cognition, right? The ability to be able to maintain focus, ability to be able to take in new information and retain it, and then be able to process it, and then use it to do things in the future. So just like every other muscle in your body, the brain is like a form of muscle. We always say in regards to, and in fact, there's a certain enzyme that the brain releases when like they have a stroke that's similar to the muscle enzymes that gets released into the blood. But that being said, just like when you exercise your muscles in your body, you need to exercise the brain muscle. And so what are some of the things that we can do to exercise our brain muscle?
So that's a good point. So in terms of like, what can we do to keep that brain sharp at that age range to, again, inputs get stored into certain parts of the brain and then you can output it at a different time. That means just like anything else, the more blood flow you get in there, the better class of nutrients that go to the brain will help with all of that. So we want to make sure that we're eating stuff right, we're getting the right rest, and we're exercising the brain. Sure. And there are things now that we can test, and we'll get into that later on. But again, but those are things that we see, and it's a fancy term, neuroplasticity, it's called.
That's a big word.
So neuroplasticity means that, again, we are able to do those things we've just mentioned to keep the brain sharp so you can learn new. So again, old dogs can learn new tricks.
Yeah. So for cognition, or meaning for memory, or for being able to learn and process and keep the brain sharp regardless of what age, it's making sure that you're exercising. And then there are key things like learn new things, try to like identify and do new things. Don't be, don't just keep doing the same thing over and over again, because your brain just kind of gets used to it.
You got to do some puzzles. Right. You got to do those mental exercises.
Challenge your brain, do different things, cut out all the bad stuff for you, like the smoking and the drugs. And I would say not the sex. Don't you keep doing that. That part,
that's exercise,
right?
Especially if you do it the right way.
Right.
But so now again, so I think we beat that to death.
Mm-hmm.
Now I think we maybe shift over to some of the other parts of the body, right?
Yep.
And maybe it's a good time for us to explain, as we start talking for the next topic, some of the things in terms of the joints and the bones and all these things, and how the other parts of the body, and probably also explain at this time too, maybe why we're wearing these shirts.
Right. So for many of you who don't know, Greg and I, we have. I mean, I'm actually more of a girl maker than you are. I have 3 daughters.
Yeah, and I got obviously I got my 2.
We both have 4 kids, but you kind of split them up. But I'm
boy,
outnumbered,
girl,
man.
Girl. I said, hey, above every girl, I need a boy, right? I gotta have somebody watching over my girls. So I had a boy, girl.
Yeah, no,
Not
for
by
me,
design, it just happened.
Yeah, for me, I'm outnumbered, man. Like, I had my one, my one boy, and yeah, he and I were screwed because we were just surrounded. Even we have a dog that's a female. We're just like, man, there's so much estrogen in the house. We were screwed, man. We didn't have a chance
But your daughters are awesome, and yeah, nothing scares me because my 2 daughters.
Right.
But again, part of some of these things that we want to talk about too is the physical activity of the body, the joints, and all of these things that we want to get into, right? So again, and since we're talking about females, let's talk about that first. Let's talk about what happens at this age range for females in terms of their bodies, their joints, and their bones, right?
Yeah. So when we get into our 50s and above, for women, not only, I know we talked in an episode or so ago about like the drop in hormone levels in our mid 40s, but once we start to get in our 50s and 60s and above, for women, estrogen starts to drop, progesterone starts to drop, which are some of the main female driving hormones, because over time, that's just a natural process. So as the ovaries start making less and less of that hormone, they'll make a lot of changes. And a lot of those changes that are dependent on those hormones can cause a bunch of things. A lot of mood stuff, a lot of stuff with like, maybe slowing down their metabolism, and then their bones start to get a little more weak or brittle.
So, yeah, the biggest part of it, of course, is this whole thing that you'll hear us talk about is this osteoporosis risk, osteopenia, osteoporosis. That just basically, it's a fancy way of saying your bones, because those hormones have now started to get more brittle, and they can actually fracture. And in some people, it's even their own body weight or slips and falls that can happen at this age. They can break their bones because, again, those hormone levels are starting to affect the thickness of their bones. The other thing that affects it is exercise. You don't exercise, it's going to start to wear down on the bones, and that's going to impact things as well.
And the good news is, like, so, for many years, we were in the medical world because of some studies that were kind of, I guess, maybe misinforming the healthcare community in regards to like kind of like poo-pooing and making that like hormone replacement was a bad thing. And we started to recognize that hormone replacement maybe isn't such a bad thing.
It actually isn't. And now we know more and more, even people who've had a family history of breast cancer, where we said, hey, you shouldn't be on it. Now, we actually probably should be on hormone replacements, because hormone replacement can improve bones. But the other hormone that people don't talk about a lot is vitamin D. Vitamin D is a pro-hormone, and that one also starts to shift. And we especially see that in certain populations in the Midwest that we're in. We start seeing, again, vitamin D levels. 70% of the population has it, and that affects bones as well.
Yeah,
so, and guys, testosterone drops, that affects bones. So men, women out there, check your hormone levels, and then strengthen your bones and make sure you're getting your bone densities so you can get the bone stronger and not get into trouble. That's going to be one of the biggest things.
Yeah, so maybe talking about all this stuff about bones, maybe we can go into another topic.
Let's do it.
All right. Well,
what do you want to talk about?
Well, I'd say bones. I mean, I think maybe we should be talking about maybe.
I get you. Yeah, the social side of that age range now. Yeah, let's start talking about a different type of bone. And what can we think about in terms of what we get a lot of issues in terms of, again, at this age range, social isolation, relationships start to fall apart. See where we went there?
Right.
Yeah. And then of course, people start losing, well, what's my purpose? And they start getting closer to their the later decades in life. They start questioning those kinds of things.
Yeah, for sure. So like as many times when we start to getting into our 50s, 60s and above, I mean, a lot of times people are either the relationships have maybe kind of like broken apart, and or friends or relatives that they had in their age group, they start noticing either people are no longer around, or they're people that in their peers started getting a bunch of health issues, and because that's just part of life. So it's like within their social pool, they're like, oh, Johnny Susie now has cancer, or Johnny Susie just had a heart attack or a stroke. And that can really start messing around with like people's brains, and like they can start losing friends and relatives and loved ones, and start getting more socially isolated, getting more depressed.
Their kids at this age range are now, are becoming professionals. They have their own families. They're starting to, again, focus on a new micro family that's outside of the parents. And so then now they're starting to feel more isolated. This is a good time for us to remind everybody hey, this is when you need to start developing a different social grouping. Hey, start getting into other social clubs, start doing other things, start finding friends and other relationships that you can, and hobbies and things like this because you need that at this age range to maintain that social circle, because we're social animals. And the other big thing, I remember back in the day when we used to round at like nursing homes and things like this, right? And you get to the extremes of age past the 60s.
You remember when we were rounding at one of the places and like everybody all of a sudden just got chlamydia and gonorrhea?
Yeah.
Made me wonder,
so
like,
little C, right? Everyone was, there's a big, you got this huge, pocket of people who are worried about the big C at this age range. But then we saw, there was the little C and some of these other like
that
STDs.
goes back to show like when they were congregated and socially all of a sudden started to like, it's like just was to show that like, hey, people in their 60s and 70s, 80s can still have sex and still have fun and still be doing all that fun stuff. But just be careful, make sure you're wearing protection, because we don't want to have to go through with a shot of penicillin for everybody and give them like.
We went through a lot of injections at that time period. Yeah.
Right. Which was, hey, it was awesome. Yeah. I mean, the part of them having the STIs wasn't awesome, but like, but at least it was like, hey, they were having fun.
Yeah, and it was fun because you had to kind of find who started all this. The puzzle of like who was the initial person who did all these things. So, but that's again back to what we're talking about. It's important to make sure that you have social connections. You're expanding your social profile. When you start getting into that whole my family that I've spent a lifetime with is starting to shift and start their own families. You need to start creating your own social network for later on in life.
Yeah. So in conclusion, from that perspective, yes, I mean, social isolation, make sure you're getting out, doing the different things, try to find the places where the community centers, that kind of stuff.
Transmitted diseases are still something at this age. So protect yourself, don't do that.
Hey, that's a good segue. Maybe we should talk about another topic, maybe medications and people in a certain age range.
Right. So yeah, let's go over some meds that we see at this age range too, because again, as we start getting into our 60s, and as we mentioned before, this is when we start seeing that the body and metabolism and things have shifted. Certain things that we're not going to outpace, your vascular disease and pulmonary disorders and some of these other things that we see. We see that, again, more and more people are going to be taking medications and supplements or mixing it, not pill parties. I'm not talking about that. I'm talking about they're actually on multiple meds, and then how to actually, how do you manage those medications? Because it could get tricky. We have patients on what they call polypharmacy, which is just basically means you're on 5 or more medications.
Yeah. I mean, because the reality is after you get to be in your 50s, 60s and above, I mean, and actually I was just looking at it too long ago. I mean, I think that when I looked at our patient cohort at Epic Health, we had maybe 9+ health conditions for our patients that were 50 and above. Which it's. I mean, again, we have our population as we get older, but also just in general, are not as healthy as we'd like to be. Which means that comes with what we call chronic conditions, and maybe we can explain the difference between chronic conditions and acute conditions.
Sure. So again, a chronic condition means it's lasting over time. Right. This is something that is going to last a while, like high blood pressure, diabetes, high cholesterol, heart attack, stroke. These are all chronic conditions, as opposed to, I fell, hit my knee, and now it hurts. That's an acute condition that's just going to last so long.
Or I visited my
Most people-
grandchild and they had some upper respiratory thing, and now I'm stuffed and congested and coughing and sniffling and sneezing because that little. But yeah, so that's the difference from something acute, meaning it has a beginning and an end. So it has a timeline versus something that just doesn't have a timeline, just keeps going. And then with that, a lot of times, unfortunately, comes medications, and there just comes a lot of medications. Sometimes it's a medication to treat all the different things. But
sometimes you get medications to combat the side effects, and that's where you start making sure that, again, if that's happening, you got to kind of take a pause, work with your provider, make sure that you're addressing these things and saying, hey, what can I do to come off of some of these things? Are these the right medicines for me? Am I taking a medicine because of a side effect of a medicine? That happens, unfortunately, and then that just kind of escalates.
Okay.
And then, of course, when you start doing the right thing, meaning that, okay, I'm going to start changing my lifestyle, I'm doing all of these things, I'm getting to the discipline I need to, then what ends up happening is sometimes people forget to start looking at their medicines and saying, hey, they probably need to shift it down.
How many times have you heard people say, like, doc, you just want to throw pills at for everything? You guys, you doctor people, you just want to put pills on everything. Just give me a pill for everything.
Yeah, and then you're like, okay, well, then you're going to need to make sure that you're getting proper rest, exercise. I need you to do this, 4 times a week, resistance training. I need you to get 180 to 210 minutes of zone 2 cardio a week. And they're like, isn't there a pill I can take for that?
Right. They're like, just give me a pill, man.
Yeah. So
like, right.
So
careful what you wish for.
So then that goes back to then you're on these medications, you have to be on them. And we understand some of these medicines you have to be on there because, again, either genetic or hereditary or acquired conditions. Then you want to make sure that you're working on that, you're taking them at the right time, you're staying pretty consistent with the timing. If it's twice a day, you're trying to stick within an hour up and down of the time you're taking it and trying not to miss it. And if you do miss it, talk to your health provider on how to actually then adjust for the misses, because it happens. Life happens. So we want to make sure that happens.
So talking about all this like chronic conditions and all this stuff that just happens and compiles, but like what can we do maybe for prevention? Maybe that's something else we can bring up and talk about.
That's a good point. So maybe this is a good time that let's transition over to beyond just the medications and all the other things we need to do. Let's start talking about things like what you can do for avoidance and how can you screen and do other things to avoid conditions in the first place. And those are the things that we talked about, like vaccines, lifestyle changes. And of course, getting your screenings, because screenings are even more important. We talked about bone fragility, again, because your bones start to get weaker because of the things that we talked about, hormone drops and vitamin D levels dropping. So we want to make sure we're doing the screenings, like your bone density. If you're a man with low testosterone, you're a woman who has gone through menopause, you got to get your bone density testing. That's a good screening test to get done.
Right.
What else?
So in a previous discussion, we talked about acute conditions and chronic conditions, meaning acute, meaning something that has like a beginning and end. Chronic is just like stuff that is just there and it's lasting. And then that brings us to the third, which is prevention. So again, that's kind of really what we're talking about right now. We're talking about prevention, how to prevent bad stuff from happening. And I always tell everybody, we can give you some things to prevent, like vaccinations. I mean, that's, we're trying to prevent bad diseases from happening. Generally, those are the things that are more infectious, some kind of communicable, something you can catch from somebody. Then we screen for things like trying to prevent you from like having a bone fracture easily, fragile bones.
Sexually transmitted infections, right? You gotta
right.
How to prevent that.
Right.
So, yeah.
And then we start searching, because unfortunately, every year that we get older, we know that our bodies and our cells start to kind of wear down a little bit, and the cells can maybe get a little bit more irregular, and then it may increase risk of getting certain cancers.
And your immune system is not what it used to be. Again, the things that help us to fight off respiratory and gut infections, so lung and sinus infections are higher because, again, your immune cells aren't where they're supposed to be. And based off of all that, this is when we really push hard on the vaccinations. Getting your flu shot every year, making sure that, again, if COVID really was a thing or not, don't answer that. But again, making sure that all the vaccines, this is your pneumonia vaccine time, your flu vaccines, and getting all your shingles vaccine.
So shingles, pneumonia, COVID, flu, RSV, tetanus, all these things that pertussis. I mean, these are things that we see that, again, we can prevent just by giving a vaccine. So it's really important to make sure you get those, because, again, as we get older, those things hit a lot harder, that's for sure.
And the other screenings, of course, is because of the other conditions, like you mentioned, vascular and cancer screenings. You're getting your colon screening, you're getting your breast screening, your prostate screenings, you're getting again, your heart and vascular screenings, all those testing that need to happen at this age range on a regular basis, because if we catch early, we can do something about it.
Right.
Catch late, right? We talk about if you catch it early, you can cure. If you catch it late, you just treat.
Right. That's where a lot of times, like when patients will come in and ask me for, to check some obscure things, like I heard my, one friend did this one obscure test that, detects something 1 out of every trillion. I always tell them, like, screening tests we check for screening tests for a couple reasons. We check for, like, if there's something that's common, and we check for that if it's common and we can catch it early, we can do something about it. So
do something about it.
It's like, why are we going to screen for something if, like, we're just going to tell you you're going to die faster, and it's very expensive and 1 out of every trillion people. But it's like, we screen for things that are common, and we screen for them that if we catch them early, we can do something about it.
Very cool. So we went over a lot today. I think, again, as a kind of quick little conclusion here, we can sum up by saying aging doesn't mean that you have to stop. And it doesn't mean that, I'm going to go through all of these things. If done correctly, when you're going through your 60s and beyond, you don't have to worry about memory issues.
Maybe we should call it
issues.
younging instead of aging.
Yeah, I love it. So again, how do we get them young again, right? So it's the fountain of age.
And and go back to at Epic Health, where, what the health, at Epic, we suggest, don't go Googling, don't take chances with your health. If you have some issues, if you have some symptoms, if you've got some health issues, you want to make sure that you're being seen by a professional, and making sure that, things are monitored carefully, making sure you're not on too many medications, and you're on the right medications, and you're having all the right screening tests and all the different things that we talked about in all the different episodes.
Yeah, let's really make this the golden years.
Yeah.
Love it. All right. See you guys soon.